Can you kind of go into the work that you have done with the treatment of heart disease and what you have found to be the solution?
The leading killer of women and men in Western civilization is coronary artery heart disease. And if the truth be known, this is really nothing more than a toothless paper tiger that need never ever exist. And if it does exist, it need never ever progress. This is a benign foodborne illness. And I say that because if we look, for instance, at some of the cultures on the planet today, like the rural Chinese, the Papua Highlanders, the Central Africa, or the Tarahumara Indians in northern Mexico, uh, cardiovascular disease is virtually non-existent in these cultures. Why? Because by heritage and tradition, they consume a plant-based type of nutrition. And this is really sort of the guidepost of so much of the research that we were involved in. With our first small study in 1985, when I was initiated, it started with patients who were absolutely ravaged with heart disease. And we asked them to, in essence, stop the foods that were injuring the lining of their artery every time that passed their lips. I mean, I think all experts in this disease would agree that where this disease has its inception is when we progressively destroy that life jacket and guardian of our blood vessels, which is that single layer of cells that lines the innermost part of our artery, the endothelium. And the endothelial cells manufacture this wonderful magic molecule of gas, nitric oxide, that has a number of marvelous properties that protect our blood vessels. It keeps all those cellular elements in the bloodstream from getting sticky. It also is the strongest vasodilator in the body. When you climb stairs, the arteries to your heart dilate. The arteries to your legs dilate. Nitric oxide. Number three, nitric oxide will prevent the arteries from becoming inflamed, stiff, and thickened. Prevents hypertension, high blood pressure. Number four, a plentiful normal amount of nitric oxide will prevent you from ever developing blockages or plaque. So it's pretty key. And now over the years, various investigators have identified what are the foods that every time they pass our lips, we injure the endothelium. We make it dysfunctional. So constantly, our levels of nitric oxide throughout our lives are getting lower and lower and lower. As a matter of fact, we know that when you autopsy the GIs, for instance, who died in Korea from battle wounds, 80% of those GIs who are average age 20 already have gross evidence of coronary artery disease. Not enough for their cardiac events yet, but there the disease is already established. And when that study is repeated 45 years later in 1999, this time looking at young women and men who have died of accidents and homicides and suicides between the ages of 17 and 34. Now the disease is ubiquitous. You graduate from high school in this country, you not only get a diploma, you get the foundation for heart disease. And it's no surprise that as you continue to eat the same way through the 20s, 30s, and 40s, now we begin to see these actual cardiac events, which are sort of the end stage of a disease that has been going on since childhood.
Wow. So this is no doubt that this disease, well, there's no doubt that it's diet related, but it can also be treated.
Look, since the days of Hippocrates, where the caregiver and the patient have done the best of all is when the caregiver is willing to share with the patient what is the causation of the disease, causation of the illness. Today, that's not being done in cardiology. What we do is the cardiologists, and although I embrace their caring, their compassion, and their fund of knowledge, none of the drugs that they're using, none of the procedures such as stents and bypass they're using have one single solitary thing to do with the causation of that disease. It is stopgap, patch job, symptomatic care. And that's why these patients often simply cannot be cured. But what does happen when you treat the cause of the disease, when you ask them to stop eating those foods, It is absolutely sometimes nothing short of miraculous when you see what happens.